Dr. Houman Farzin. Dr. Houman Farzin is a palliative care physician at the Jewish General Hospital in Montreal, Canada. He serves as clinical faculty at McGill University and is a member of training and ethics committee at Therapeutic. His current research interests include psychedelic-assisted therapies and the use of cannabinoids and exercise in treating chemotherapy-induced peripheral neuropathy in cancer survivors. Houman's talk will be about a real-world case series with advanced cancer who received both individual and group psilocybin-assisted therapy in Montreal, Canada. Houman, the floor is yours.
Thank you so much. Hi everyone, thanks for joining, and thanks to Joost, our host, and his wonderful team. It's a real pleasure to present here again. So I'm visiting from Montreal, Canada. Some disclosures: I was involved in the MAPS research, part of the phase 3 clinical trials, and still work with MDMA. I won't be talking too much about it today, but it's a really exciting field that I'm passionate about, and hopefully things can move forward with that. I am an early investor in Beckley SciTech, and currently launching my private practice, which I'll talk about a bit later. I'm faculty at McGill University, where the term palliative care was coined, and I teach at the Jewish General Hospital. I have some research funding, and I've been working closely with Therapeutic. Therapeutic is a non-profit Canadian organization that has paved the way to legal access for psilocybin-assisted therapy, primarily for end-of-life distress, and now expanding into treatment-resistant depression and other indications, perhaps even cluster headaches soon. A quick ode to my mother, who was a cancer patient. She inspires my work. And if you didn't see me speak at the last ICPR, you could probably access that video and learn more about that story. And I'm happy that my lovely wife is here and she illustrated this image. So in Canada, 1 year after the United States, psilocybin was banned in '74, and that continued until 2020, where an advocacy campaign for 4 end-of-life patients resulted in successful access through what was called the Section 56 exemption. And so that is an exemption to the criminal code where the government, Health Canada in this case, gave permission to the patient to get access to mushrooms from the black market. So that's when the taboo was broken. And about 2 years after that, psilocybin and MDMA were added to the Special Access Program. And the Special Access Program is an existing program. It's been around for decades and essentially allows practitioners that want medicines that aren't approved in Canada to apply for a given patient. And psilocybin and MDMA are now part of the Special Access Program. What we see there is the first patient treated in Canada, the first access through the Section 56 in Quebec, and one of our patients, Robert. So part of the idea of getting access was because of the federal allowance of medical aid in dying. And so, as you know, in the Netherlands, they've been ahead in that sense to offer medical aid in dying in the healthcare system. And so Canada adopted that federally. And so we were able to argue if a patient has the right to die in the medical system, they have the right to try. And so successfully we gained access. And the reality is in Quebec now, we have the highest rates of medical aid in dying in the world. And it's not always a bad thing. It's actually really beautiful. It empowers a lot of patients that have lost their autonomy to disease. And they get to choose the setting in which they die. So it's really beautiful. But the idea is that they should have alternatives. The reality is most of them are not choosing this form of treatment, which is covered by the medical system due to physical suffering, but more psychosocial suffering. how many have heard of the Special Access Program or knew that Canada has access to legal psilocybin? And so we see that, probably about like 5%. And this is a poll we did in Canada, and only a minority of people in Canada even know we have access. We're sort of in a bit of a press drought. Canada doesn't get as much coverage, but well before Australia, we had this access, and Switzerland was the first model that laid it out. And so we've been doing this work for a couple of years now, and we published a paper showing that 79% of Canadians approve the use of psilocybin for end-of-life distress. So I showed this image in my last talk, and I love it because it's just such a good representation of the process. And so this image drawn by my patient Florence after her first psilocybin-assisted therapy session shows her surrounded by this cloud of darkness. And this is what overtakes her everyday reality. So she's surrounded by these thoughts. And the first psilocybin session we did was a challenging one. The first few treatments were done with actual mushrooms. So these were 5-gram doses of mushrooms. And, it was a difficult experience, but very rewarding. In that experience, we see that her heart is tapping into the colors that exist in reality, which she doesn't have access to normally. And so she learned what the work is that needs to be done in order to get access to what is already there. And so it's been so beautiful to see her along her journey, and from being isolated and very private about her struggles, she's actually opened up, and we actually shot a documentary, which I'll share some clips shortly. And it's been remarkable to see this journey, to create music playlists for this journey, and to see the evolution of this work.
I feel it. It's coming in my...
Where do you feel it?
I feel it in my belly, in the lower part of my body. Thank you.
So part of doing the work is somatic awareness. The idea is that trauma is stored in the body. And if I were to sort of follow the thread of one of my mentors, Gabor Mate, perhaps the storage of trauma can actually lead to pathology. So let's say as an etiologic factor, the trauma in your body can lead to cancer or other diseases, especially autoimmune diseases. And we see this mind-body connection a lot. And so a lot of what we do in therapy, whether it's for psilocybin or MDMA, is focused on the body. And it's remarkable how by going to where the tension, the pain, the discomfort is, you can actually access that hidden trauma. And that's the idea with psychedelics. You're manifesting what is there, but you don't have access to in your normal state of consciousness. And so, in this practice, we see that she's sensing, and after this session, she sort of realized the sadness that's within her. And so we work with the sadness. We work with what comes up. And that's what's important in this work, is that everything is welcome. All guests are welcome, including sadness.
Lost paradise. The sadness, the suffering. The sadness when I see the state of the world, and sometimes it scares me. That's really sad.
But when you talk about compassion, you sort of bring in this drive to create change.
Yes.
And that is what takes that pain and then actually sort of channels it into something productive.
That's what I would like to do, definitely. I don't know how to do it yet.
I feel like the audio might be a bit poor, but it's amazing to see the power of music, first of all. This is the actual music playing in the session. But the idea of compassion as a way to channel the sadness into this act of kindness to creating change, and to see this patient now as a volunteer for other cancer patients as she approaches the end of her life. And so we're obviously dealing with a lot of sadness. The events around the world now are tragic, and hopefully through this act of compassion we can connect to our humanity and stop acts of brutalist crimes.
Beautiful. Wow. Wow. Oh, wow. Like everything is
Alive.
alive.
I think it's worth going back to the sadness. Started the journey with it.
But you know what? It's also probably ecstasy. Yeah, I can move beyond sadness.
And as you said, beyond the sadness is ecstasy.
Beyond the sadness is ecstasy. And that's what happens when you welcome what comes up. The biggest tragedy can become the biggest source of comedy. And we welcome what arises. In her own words, this treatment has enabled me to reinvest in my life, to give it back its full meaning. I'm again involved in my community. I have projects. I'm in contact with friends and loved ones. The idea of death, the idea of a limit to my life, is no longer paralyzing and doesn't prevent me from enjoying the present moment. This is from a radio interview we did. If you're interested in watching the full documentary, it's 40 minutes long, available for free on YouTube. It's a show called Découverte. It was aired in November, and it has automatic subtitle translation in your language of choice. So we've achieved a lot of milestones by rolling out this work in Quebec. You know, what's unique about this is that we're not doing this in the context of clinical trials. This is patient-centered clinical care. It's difficult to get access, but it exists with advocacy. And, you know, the Canadian system is one of the ones where, like Europe, you have a single-payer system. Everyone is covered with the health care. And our survey showed that the majority of Canadians support having either all or part of the psychotherapy done for this reason covered. And so, thanks to my colleague, Jean-François Stéphane, we were able to convince the billing agency and our association to cover the costs of therapy. So us practicing under the sort of College of Family Physicians in Quebec are billing for psychedelic therapy for psilocybin and MDMA, both group and individual, and this reduces costs significantly, and it was a huge success. I talked about this case last presentation, and this patient was the first patient treated with the Special Access Program in Quebec. So we went from using 5 grams of mushrooms to 25 milligrams of synthetic mushrooms that comes from an approved producer. Sometimes the mushrooms are botanical extracts. They're not always synthetic. But this patient actually spent the last few months of his life in this cottage. And it was remarkable because we were able to offer palliative home care service with the psychedelic sort of offering. And from my understanding, Montreal is also the home of the first home care palliative care program. And actually Quebec has a province-wide palliative care home care service. It's not always perfect, but it's amazing that people can spend their end of days at home. And so this patient had a remarkable experience with psilocybin, highly mystical, And despite that, he decided to do medical aid in dying. And so, many think that, by offering, let's say, psilocybin therapy for patients requesting medical aid in dying, they're going to not want to do that. But that's not necessarily the case. Sometimes they just become more comfortable with accepting things as they are. And acceptance is really the first part of this process, accepting what is. And, he was able to accept his condition, and the suffering he was enduring because of all the physical pain led him to choose medical aid in dying only a few months after doing this treatment. I actually published an article, narrative report on his experience, and the idea is that you can have healing despite the fact that you're dying. And so we teach mindfulness at McGill Medical School. It's a mandatory course to students, and so the physician and the patient, they have this relationship, and that relationship can result in healing independent of the relationship with the disease. So sometimes a physician can cure a disease, but sometimes you can't, and actually most times you can't cure, but you can still facilitate healing. And so this article is available for free in English and French. You can look it up. The cases we've had are really astonishing and also show that it's really hard to do this in clinical trial settings. So this case of a patient, retired nurse in her 70s, advanced cancer, probably months to a year left in her life, suffering immensely on antidepressants, on benzodiazepines 4 times a day, drinking 1.5 liters of wine daily, all to calm her anxiety. And we had a very profound psilocybin session. The first patients, we actually weaned off the antidepressants. As new data emerged, we've been more cooperative because the withdrawal discontinuation syndrome sometimes is actually harmful to the patient. And so we treated her while she was on her antidepressants with psilocybin, had a very profound session. The second time she had a profound session was by viewing the video of the first session. So the impact of the session was so strong that just by viewing the video of that session, she pretty much had a second experience. And what happened is about 6 months later, she had this magical moment where her life transformed. So she sent us these flowers. We encourage patients to buy themselves flowers for the session, part of the setting, and it's just beautiful to have that experience. But she texted us or emailed us the day after with the photo saying the flowers have blossomed. But she only saw the results of that 6 months down the road. And what's interesting is that there's literature showing that it's similar in psychotherapy. So sometimes you're doing psychotherapy, you might not get results immediately. It takes time to process these things. And that's why sometimes in clinical trials and psychedelic studies, it's hard to prove through these objective measures what that change is. But the value of the story, the human experience is profound. This is another patient, and it was incredible because this is a younger cancer patient, and she says that her first love was poetry. And so she would enter these creative states where she would write poems, and the realization she had in her psilocybin experience was the most important poem she'd ever written was essentially written from her inner child. This exiled inner child that she had to force away was communicating to her adult self via poetry when she was able to tap into that state. And it was just like a profound moment of realization during the psilocybin session that she had to connect with that inner child that's sort of trapped in the confines of her consciousness. And we've done amazing work since. And based on evidence that was emerging and other colleagues' work, we were able to convince the Cancer Wellness Center associated with our hospital to allow for group therapy. Psilocybin for cancer patients done, all covered by the healthcare system, done in a setting where we don't have to pay for the location. And we were able to treat 2 patients simultaneously with 3 therapists instead of 4. So that's like 25 to 30% reduction in therapy hours required, and that is a major barrier for access. And I just want to take a moment to talk about MAPS because I'm passionate. I took this photo at Rick's place. It's the painting by Alex Gray. And just to say that we're also doing MDMA therapy. And we did our first case, very successful. And sometimes you can't demonstrate this in a clinical trial, but the stories are so profound. This is real work. And so hopefully we'll have some momentum there. And in terms of future direction, I've been building this concept of mystic health for a few years. And the idea is having this mystic health as a core component of health. And, it's an individualized approach. And perhaps as one enters end of life, as one is grappling with serious illness and existential distress, the importance of mystic health, the importance of feeling one with all, of continuity of being, is something important that we can bank on. And that was it. Thank you.
Thank you very much, Houman. We have room for one question. I saw you were first. Sorry.
Amazing. Thank you so much for your presentation and for your work. I'm a cancer survivor and a young cancer survivor. I was diagnosed with advanced stage cancer in my early 30s. And one of the things I'm really interested in is opening up the idea of palliative care to a wider group. So for young cancer survivors, the chances of us of having anxiety and depression and lots of other kinds of disorders is very, very high. And a lot of us are living long lives, but they're not very good lives because of the threat of recurrence and the anxiety that comes with that. And so I was wondering if you've thought much about expanding the meaning of palliative care to people who have to walk alongside death for a much longer period of time.
Thanks for that question. Actually, all courage to you. The actual purpose of palliative care was to take the concepts of hospice care, which is end-of-life care, and apply it earlier on disease. And evidence shows that early palliative care actually improves outcomes in cancer care. And I had a heated argument with the Health Canada responsible sort of agent last week over a patient who is technically cured, but has to go in every 3 months for blood tests. He has all kinds of ailments related to his treatment, living in constant anxiety, and they don't want to give him access through this pathway. And the reality is that the suffering is different than, let's say, just treatment-resistant depression. And so I'm a huge proponent of that access. And I think it's a matter of activism, of expressing our opinion, and hopefully making that happen.
Thank you. And there's a nonprofit I founded with other cancer survivors called the Survivorship Collective. So if anybody's interested, please come talk to me about that.
Thank you. Thanks.
Thank you. We have room for one more brief question. I heard Rick Doblin has one very brief question.
Well, it's a brief question, but it might be a difficult answer. So you're one of the very few group of therapists and psychiatrists that has experience both with psilocybin and with MDMA. So I'm curious how, when you were presented with a new patient, how do you think about which to go first with, or would they do both, or how do you compare the two?
Thanks for the question. Just to clarify, I'm not a psychiatrist. I'm a palliative care and family physician, but Health Canada has a very strict guideline based on existing evidence. So we use MAPS data to get access to MDMA, and it's only for PTSD. So we're in an active struggle to get access for patients that don't meet the research stringent criteria. So unless a cancer patient has a clear treatment-resistant PTSD diagnosis, they can't even get access to MDMA. But what I would say is that, MDMA, the beauty of it is that it just taps into the emotion. You don't have to do a lot of work to bring someone to the body, to the emotion. It just magically goes there. Whereas with psilocybin, you really have to bring them back, and it's not as easy to work with the emotions in the body. you know, if you're having ego dissolution, it's sometimes difficult to work then with your biographical information. And so I think MDMA is magic, really, like, and we have limited experience, but I'm very optimistic for how we can use it. Thanks, Rick. Yeah, cheers.
Thank you.